Hello everyone, welcome to another video. So in the last video we treated onchocerciasis, that is river blindness. So in today's video we'll be looking at rubella, or another name that for rubella is also known as German measles. So rubella is actually a contagious viral infection and is particularly caused by the rubella virus, which is a part of the family known as the toga virus. So rubella typically causes a mild illness at first in children and adults, but it's extremely dangerous during pregnancy due to the risk of causing there's something known as congenital rubella syndrome. And this congenital rubella syndrome is like where rubella causes like birth defects in the baby. So how is rubella transmitted? Rubella is basically transmitted through respiratory droplets, similar to common cold. So if somebody coughs on you, so it's similar. And because symptoms can be very mild or even absent, especially in children, rubella can spread easily before a person knows that they are even infected by rubella. So like I said, rubella is often called German measles because it has a resemblance to the condition known as measles, but it is caused by a completely different virus and is generally milder than measles. So how exactly does this rubella virus enter the body? So the rubella virus, it enters the body through the nasopharyngeal mucosa, that is the lining of the nose and the throat, and when it enters the body it will then replicate in the lymphoid tissues, particularly in the throat and near the lymph nodes. So from there it spreads into the bloodstream, and this process is known as viremia. When a virus like enters the bloodstream and spreads in the bloodstream, is known as viremia. And when it spreads into the bloodstream, it allows it to disseminate throughout the body, like the virus disseminates throughout the body. So the virus particularly affects skin cells, causing the rash, and it affects immune cells too, leading to swollen lymph nodes. So in pregnancy, the virus can cross the placenta and infect the developing fetus, affecting the organs like the heart, the eyes, the ears, and the brain. So this is how it causes the congenital rubella syndrome, because it can cross the placenta. So the causes of rubella. So rubella is particularly caused by the rubella virus, transmitted from person to person through respiratory droplets when an infected person coughs or sneezes, and it is also spread vertically, that is from an infected pregnant woman to her baby through the placenta. So looking at the signs and symptoms usually appear 2 to 3 weeks after exposure, and they are often mild. Like for example, there is low grade fever, like fever below 38.5 degrees Celsius. Then there is presence of a fine pink rash that starts on the face and spreads downwards from the face. Then there's swollen lymph nodes, especially behind the ears and at the back of the neck. Then there will be a presence of mild joint pain, which is more common in adult women. This symptom is more common in those group of people. Then mild conjunctivitis, that is presence of red eyes. There will be fatigue and there will be malaise. So in many children, rubella may be asymptomatic, so they might not even experience any symptoms at all. So I'm looking at this congenital rubella syndrome that occurs in babies. So if a pregnant woman becomes infected during the first trimester, the virus can cause birth defects in the baby. Like it can cause deafness, it can cause cataracts, that is having cloudy lenses in the eyes, It can cause heart defects, developmental delay, microcephaly, as presence of the baby who have a small head, then liver and spleen problems, and something known as a blueberry muffin rash due to the blood related problems. So looking at other conditions that can mimic the same symptoms as rubella, like I said, measles is the first one. But when it comes to measles, measles usually comes with a higher fever than rubella. It comes with more persistent cough and more severe rash. So rubella can be seen as like a milder form of measles. So measles, then scarlet fever. Scarlet fever is caused by a bacteria, and it includes presence of a sandpaper-like rash, and there's also sore throat. Then there's also another condition known as roseola. So roseola usually is present in infants, and the rash appears after the fever has resolved. So that is the distinctive feature in this roseola. Then some drug reactions to like with certain antibiotics, like if somebody is allergic to certain antibiotics, they can have like some skin rashes that can be similar to the ones that are seen in this rubella. So if somebody maybe the patient has an allergic reaction to a particular kind of antibiotic, like let's say penicillins now. And also there's another condition known as infectious mononucleosis. So in this case, the patient can have a rash and also swollen lymph nodes, same as we see in rubella, in this rubella. So when it comes to the treatment, there's no specific antiviral treatment for rubella, and the management for this condition is supportive, aiming at like relieving the symptoms of the condition. For example, giving paracetamol or ibuprofen to reduce the fever and help with the joint pain, and also giving adequate water, try to keep the person hydrated, rest, and also isolation during the contagious period of the infection, at least like 7 days after the rash appears. So the treatment is just supportive. And in children and adults, we try to give them supportive care. We try to encourage them to avoid close contact with pregnant women, and we try to inform the public in cases of where there's like a rubella virus outbreak. And also rubella is actually preventable through vaccination. So there's a vaccine for rubella, and it's usually given in combination as measles rubella or measles mumps rubella vaccine, so MMR. So there's a vaccine for this infection, and the vaccine is typically given in 2 doses during childhood. So the first is given at 9 to 12 months. The second is given at 15 to 18 months or older. So when it comes to pregnant women, so women of childbearing age, they're advised to confirm immunity to rubella before or early in the before pregnancy or in early stages of pregnancy. So usually live rubella vaccine is not recommended to be given during pregnancy, but postpartum vaccination is advised if the immunity of the pregnant woman is lacking. So if rubella infection is suspected in the pregnant woman, serologic testing such as the specific rubella IgM and IgG should be done immediately this rubella infection is suspected in the pregnant woman. So in summary, rubella is a mild viral illness that causes fever, causes rash and swollen lymph nodes, and it is especially dangerous during the early stages of pregnancy due to the potential risk of causing congenital rubella syndrome in the baby. So presently there is no specific treatment for rubella, but the disease is entirely preventable with the rubella mumps measles vaccine. So as a pharmacist, it's my role to encourage immunization, provide symptomatic relief, and educate patients, especially women of reproductive age, women that are planning to get pregnant, and also try to give try to support public health efforts in curbing this infection known as rubella. So thank you for watching this video, and I hope you watch the next video. Thank you. Bye.